Hi, everybody. Welcome. Good morning. So it's really exciting to be here today and to be able to have a conversation with you about the important work that you're doing with young people in Boston. We know young people in this country are facing incredible challenges in terms of developing to their full potential. And it's really important for us to remember that these are not bad kids, the young people who are challenged and are experiencing hardships, and that the issue really is about lack of access to opportunities and policies and institutions that are failing our young people. And health departments have a really vital role in this process to play in terms of being able to help promote health and well-being for our young people. So I'm really excited to hear more about the innovative work that you're doing in Boston to promote health in young people. Can you start by telling us about how you use a public health approach to work with adolescents in terms of policies and programs?
Thanks so much for the opportunity to talk about our work in Boston. And in terms of the public health approach that we take in the city, it really is a framework that we've adopted in the city, in the state, and across the country in terms of Public Health 3.0. And this is really the role of our local and state health officers and their staff as being chief health strategists. And what that means to us is that we use the public health data that we have and make sure that it's timely, it's actionable, and that we're using it to drive program design and implementation. We also, in terms of this framework, are focused on ensuring that we're building strategic partnerships and really working beyond our comfort zone, which is in public health, our healthcare partners. So doing more work with the business sector, higher ed, and a really diverse partnership, philanthropy. And those are some of the key elements. And then when you layer that approach in Boston at our health department, all of the work that we do across the organization, and particularly with our adolescent and our youth health programs, is grounded in racial justice and health equity. And this is this is our North Star, and that's the approach that we take at the health department.
That's wonderful. And it is so important to involve youth themselves in the process of developing programs and policies and to really incorporate their voice and their perspective. How do you do that? How do you engage adolescents in the work?
So I feel on a personal level, I can share that I feel like I'm an expert on this because I have a 15-year-old son and a 12-year-old daughter. So whenever I go to work and I work with our programs and our young people, I always hear my kid's voice in the background. At the commission, one of our bureaus is the Child Adolescent Family Health Program, and that's where over 8 youth enrichment youth programs sit within the commission. And I want to share 2 quick stories to give you two examples of how we engage our young people. The first I would share is around one program called our Start Strong program. So this is a peer-based high school program where we have designed a curriculum where we've engaged the youth. It's a youth development principle, and we've layered on top of that trauma-informed principles to inform the curriculum. So the young people, our high school students, are learning about the importance of self-care, violence prevention, healthy relationships, advocacy, civic engagement, and they are with us every step of the way in terms of the agendas, the presentations, the way that the different after-school programs are led. And shortly after I returned to Boston, one thing that kept coming up from our peer leaders was the influence of sexually explicit media in their relationships and needing us to be able to help them develop skills to navigate what really in essence was pornography and the unhealthy stereotypes, unhealthy portrayals of relationships in what they were seeing. in social media, in pornography. And I never thought as a health officer that I'd be flash forward talking so much about pornography. And we now have a curriculum called, it's a porn literacy curriculum, which we've done in partnership with Dr. Emily Rothman. And we have sessions that the students have actually designed the facilitator's guide, and we've woven that into what we provide to them. And so that's been getting a lot of attention these days. And I just met with the staff this week to prepare for a submission of our city budget for FY20, and I saw a new position, a porn coordinator, to help us.
I love it.
Which is not something that I've ever submitted before in the budget process. So we'll see how that goes, crossing fingers. But clearly there's a need in terms of being able to share these approaches, and they've been youth informed.
Yeah, and that came from the young people. Yeah.
Definitely driven by the young people, something that caught us off a little bit off guard, but we went with it, and they helped us shape, and they're definitely driving the discussion now. Another example where we've had heavy youth engagement is on the issues around violence prevention. And it was almost a year ago to the day when one of our students, a former student, was brutally murdered in East Boston. And this was really a hard situation for the staff, the students who knew Duncan. And a couple months later, we had the mass shooting in Parkland. And so one of our board members, who is an assistant dean, Harold Cox at Buse School Public Health, and I pulled together our youth advisory board. And we wanted to just have an informal discussion with them about Duncan, about Parkland, and all of the different opportunities that they were beginning to be exposed to and engaged with in both locally and nationally around gun violence. And it was, I thought, from our perspective, that it was an opportunity for the young people because they were really mobilized around this. Mm-hmm. And young people are brutally honest. And so they told us that they were sad because of the spotlight on Parkland and suburban white youth. And the reality is this is what they face in many neighborhoods across the city. Our brown and black students, they're experiencing chronic exposure to trauma. They're not at the level of mass shootings, but many of the kids in that after-school informal session we did shared stories of family members, of cousins, of parents who are now incarcerated, and they pushed us to help them think through how do you lift up their voices? How do we figure out how to work with other city agencies? And what we landed on was a student youth-driven series of community meetings that just happened this past summer. And so every year, the health department, we've traditionally done neighborhood meetings throughout our different neighborhoods in Boston, and we dialogue. And this summer, we held about half a dozen youth dialogues. And we totally let the students drive the agenda, which was a lot for us to let go of, right? Because as public health practitioners, a good community meeting is not successful unless we have 50 slides with charts and pie graphs. And the students said, no slides, no public health data. You know what the issues are. We don't need to hear it. We live it. Let us figure out what the questions are going to be. And your role as the staff is going to help us facilitate breakout sessions.
That's terrific. And in the short time we have left, I just want to thank you for telling us, just giving us a little bit of a slice of what's going on and the important work that I think is really relevant for cities all around the country. So thank you so much.
Thank you.